Hi, my name is Matt Morris and I'm a clinical psychologist at the Center for Integrative Health. And my goal for today is to show you how to do a thought record. Thought records, I think, can be a very powerful tool for helping us to understand patterns in our thinking that may contribute to difficult or unpleasant emotions such as anger, depression, and anxiety. And thought records can also be an important type of coping tool for helping you to regulate your emotional responses. So many of us right now are struggling to cope with the stress and uncertainty of living during this pandemic. And thought records can be one important tool for helping you to identify as well as to modify unhelpful patterns of thinking. So my goal for today is first to provide you with an overview of the cognitive behavioral model that guides much of the treatment that I provide at the Center for Integrative Health. And then I'm going to walk you through how to do a thought record, what the different phases of the thought record are, and I'll give you two examples that I hope will be relevant to some of you during this pandemic. And once we've gone through the nuts and bolts of how to go through a thought record, I'm going to talk a little bit about how to practice thought records and how to use them in your day-to-day life to improve your coping. According to the cognitive behavioral model, our thoughts, emotions, behaviors, and our physiology are all interconnected and are influenced by the environment in which we find ourselves. And one simple example I'd like to give to illustrate the cognitive behavioral model is skydiving. So you have two individuals who are on a plane that's flying through the air and they're about to jump out. But these two individuals, even though they're in relatively identical situations, they're experiencing very different emotional responses. The first individual is excited. They are perhaps anticipating a surge of adrenaline, the thrill of jumping out of the plane. Maybe they're even envisaging the beauty of observing the landscape as they parachute slowly down. The second individual is feeling terrified. They're perhaps having images of jumping out of the plane and their parachute not working and them plummeting to their deaths. So same situation, they're just interpreting what's going on differently, and that's producing a very different type of emotional response. Now those emotions in turn are going to influence behavior. The first individual is likely motivated to jump out of the plane, whereas the second is likely reconsidering their decision to do this and may even decide not to jump out. So let's go through a thought record. The first step in doing a thought record is to identify and explain the situation in which you were experiencing some type of negative or unpleasant emotion. It's the where, when, what, and who of that situation. And you're describing it as though you were writing a play. So for this particular individual, they were at home, it was morning, they were eating breakfast, and they happened to be watching the news when a story about COVID-19 came up. So the next column is identifying what were the emotions or feelings that you were experiencing in that situation. So for this individual, they identified anxiety. They rated the strength of that anxiety as 70 out of 100%, with 100% being the most of that particular emotion they've ever felt. They rated their frustration levels as 60%, panic as 80%, and feeling sad and down as 70%. So notice it's not uncommon for there to be multiple emotions going on at the same time. The third column is really one of the hardest columns, and this involves identifying what was going through your head at the time that you were feeling that way. So what were the thoughts or maybe the images that were going through your head, and also what were you afraid was going to happen? So in this case, the individual said, my family doesn't care about me, I'm going to die, and there's nothing that I can do. So the next step in the thought record, after identifying all the thoughts that were going through your head, is to select one hot thought, as we call it, that is most directly tied to a particular emotion. So in this case, the individual circled, I'm going to die, as being the thought that was most directly connected to feelings of panic as well as anxiety. And so after identifying the hot thought, we're going to go through and evaluate evidence that supports that thought, as well as evidence that might contradict that thought. And in this case, we're going to start off by doing evidence that supports the thought. So we want this to be scientific in a way. So it might actually be that your hot thought is true. We're going to list here just the facts, so not speculating or trying to read somebody's mind, just what we know is true, what would be held up in a court of law. So for this individual, they noted evidence supporting the fact that they might die, including I'm at higher risk because of my health, so this individual's older and they have asthma. I'm also at higher risk because of my job. This individual works in a grocery store and so has some contact with other people. And a third piece of evidence might be just the fact that many people have already died from the coronavirus. At the time of this recording, there are about 200,000 deaths worldwide. So that's the evidence supporting this thought. Now, what about evidence that might contradict this thought? And this is a really important column here. So what you're looking for is evidence that the thought may not be completely true. Some important questions that you might ask yourself are, what would I tell someone close to me if they thought this? To try to get a different perspective. What would I think, or how would I think about this differently if I were calm, if I weren't feeling this intense negative emotion? And also think about, am I ignoring some important piece or some important piece of information about the situation? So in this case, the individual was able to identify several pieces of evidence against that hot thought. The first being that mortality in the United States is about 13 deaths per 100,000 people. So the chances of dying are actually quite low. They also identify the fact that they are social distancing and staying home when they can, and that they're taking multiple precautions, including hand washing, to reduce their risk. So after going through the evidence for and against, the last step is to evaluate the evidence and see if you can devise a more balanced thought if you determine that your hot thought is maybe unhelpful or unrealistic or inaccurate. And a balanced thought here is something that summarizes all the evidence, ideally in one sentence. It focuses on what's most likely to happen, not what you worry might happen, but really what's the most likely event. And also it focuses on, is there another way to think about this? So for this particular individual, they were able to identify two perhaps more balanced thoughts. The first was, if I'm more careful, I can lower my risk for getting it. And the second was, even though many people have it, I'm still at low risk for getting it myself. Okay, so let's go through a second thought record now. And for this one, we'll take a different thought that was identified by this individual while they were at home eating breakfast, watching the news about COVID-19. So for this one, we're going to select, my family doesn't care about me. And just as before, we're going to go through evidence for and against, and then we're going to identify a more balanced thought. So in this case, for evidence for, the individual was able to identify that, well, family members don't always wash their hands when they come home. And relatives have not been calling me very often as potential pieces of evidence that family doesn't care about me. On the other hand, they were able to identify the fact that their son picks up their medicine and groceries so that they don't have to leave the house, that relatives still send them daily text messages, and that relatives are busy handling financial stressors, and that might be why they haven't been in as regular touch rather than that they don't care about them. So evaluating the evidence for and against, we then have to decide how accurate or how realistic or how helpful is that thought that my family doesn't care about me. And this particular individual was able to identify three alternative perspectives or three more balanced thoughts. And they were, first of all, my family still cares about me. Second was, I can help remind family members to wash their hands. And the third was, I could reach out to my relatives to show them that I care. Okay, so now that you know how to do a thought record, what's the best way to practice them? Well, what I've learned from the patients that I've worked with over the years is that it's best to try practicing, first of all, in a situation where you're feeling relatively calm. for a situation that happened recently so that you still have pretty good memory of what may or may not have been going through your mind. Situations maybe within the past week or even earlier that day. Trying to go through these initially at a time when you're experiencing intense emotion can be very difficult. Now, with practice, that can be something that you try to implement. So shortly after you notice a peak in a negative emotion, you can go through a thought record like this as a way of kind of better understanding what was going through your mind and why you responded the way that you did. Even better is using these thought records in a preventive way. So for example, going through a thought record when you're feeling elevated anxiety, but you're not yet in a state of full panic. I hope this video was useful to you today, and best of luck in your practice.